3, 2, 1.
Good evening, ladies and gentlemen. Welcome to this webcast meeting of the City of York Council Health and Adult Social Care Policy and Scrutiny Committee. It's Monday, the 24th of January 2022. We do have a full complement of members of the committee here this evening, so there's no apologies for them. We do have some apologies from other participants for the evening. And these include Sharon Stoltz, the Director of Public Health, Councillor Runciman, the Executive Member for Health and Adult Social Care, Councillor Cuthbertson, the Executive Member for Children, Young People and Education, Christine Henderson, who's the owner of Bright Beginnings Nursery, and John Pattinson from the Independent Care Group. We could expect several other participants who were invited and intended to join us. So there may be one or two other people that join in, during the course of the meeting. We'll see how we get on with that. We do have a number of other participants for both of the main agenda items with us either on screen or in the background. So hopefully we'll have a good conversation this evening and hopefully come up with some tangibles. Right. Declarations of interest. Do any members have anything to declare other than that's on the register of interests, any prejudicial interests or any disclosable pecuniary interests at all with matters relating? Not seeing anything there. Okay, thank you. The agenda, the minutes of the last public meeting, which was on the 2nd of November 2021, do members agree those are an accurate reflection, or is there anything anyone wants to raise at all from those? Not seeing anything. I just want to ask, I don't know whether we've got the right people here this evening. Perhaps the Assistant Director for Public Health might be able to help, but it might be one for the directors really. But page 7, the final bullet point in reference to budget setting, it's a plans were in place to structure how savings would be delivered, implemented and monitored to enable the budget setting process to be robust. And I just wondered how this had gone since November. Anything any of the officers at present are able to comment on at all there?
I can't give you an update on that, but I can take that away and get something to you via email, if that's okay, Councillor Doughty. Yeah,
thanks. Could that be circulated to all the members, and obviously any response added to the minutes then, please? Okay. Thank you. Thanks very much. That takes us to the public participation session then. We do have one speaker. It's Ms. Edith Wu, who's registered to speak on agenda item 4 and has referenced dental surgeries and difficulty in accepting new NHS clients and the lack of emergency NHS dental services in York. Good evening, Ms. Wu. Can you hear us?
Hello. Thank you, Chair. Good evening. Can you hear me also?
I can hear you loud and clear. Thank you very much.
Okay. Okay, thank you. I appreciate this chance. Well, actually, I intend to speak about some difficulties in getting the NHS dental service here as a new citizen of the UK and also a new resident of the York. I've been here for 18 months, but interestingly, when I read the NHS paper, which is tabled at the meeting as Annex 2, I believe, the paper has already covered some of my points. So what I'm going to do would be just, to throw some follow-up questions, and then so that, for the committee to consider. Is this okay?
Yes, certainly, yes. Continue.
Okay. Okay, thank you. Thank you, Chair. And first of all, I would refer to the page 4 of the report because, NHS has already identified quite a number of key challenges for them. One of them is patient perception, which is says that, it may not be always to be clear to patients how NHS dental services work. Well, probably I'm one of the impatient. I'm one of the patients who's not clear enough. Okay, because it says that the dental services are contracted to delivery activity, that is to deliver a course of a treatment to an individual, not on ongoing regular care. Okay, so this is the NHS position, which is fairly clear. But on the other hand, as a new citizen here and I'm new resident here in York, I am so sorry that, there's no clarification to the public by the NHS or maybe other related organizations to new people like me, okay? So that's why, that I really don't have any clues and about the dental about this kind of a dental practice here. And I would also assume that, it works as what we got from a GP. That is, once we register with a GP, then we will have the then we'll have the medical care, So, actually, I was attached to a university when I first came to York about 18 months ago. And even the university, didn't explain this to me clearly. So when I had an accident and I need that dental care, and I just couldn't find anyone, and I just called some dental surgeries in York, in the city of York. But what I got the message is, they don't, I would say they didn't accept any NHS patients. Okay. So I don't know. I'm not so sure. Whether why they said that. They just simply said that we don't accept NHS patients. You can just register with us as private patients. Okay, so that's very unclear to me that even though I just need a course of treatment to in relation to my accident, I don't think I could get it. And eventually, I just, got a private. I had to go to the private practice. So that's why I wonder, what NHS has done, or will try to clarify the the dental practice under the NHS, subsidy. And and what does the and how they would supervise or monitor the dental practices to deliver the course of treatment, not regular care, to new patients. If the practice just simply said that we do not accept any NHS patients. Okay, so that's very confusing. And the second thing, and the second point I would like to raise is that, which also has the NHS report has already covered, is there's no out of our emergency dental care in the city of York. Unfortunately, I need that a couple of months ago, and I was referred to the one in Harrogate, which is but again, I didn't get any appointment, from Harrogate because I just couldn't wait because it's really emergency, right? If I could wait for 2 days, then it's not emergency at all. So that's why finally I also had to go to my dental practice here in the city of York. So so I'm not so sure, and I just wonder if NHS would do anything, to reinstate any out of our emergency service here in the city of York. And I'm sure the residents here would need this service. Okay, So I think, well, it's good that, NHS has identified, these problems as key challenges. But it seems to me that their report has not proposed any solutions in long term, short term, or middle term, or whatever, So that I'm a bit sorry to say that. Okay, so I think I have made my points, and I hope that I have made my points clear enough for the committee to consider. And okay, and I also appreciate this chance, to speak out my problems. And I hope that that other residents of York would be benefit from further improvements by NHS on their dental services. Thank you, Chair.
Thank you very much, Edith. I think we're absolutely delighted that you've joined this evening, and I think we probably all would like to see more residents take part in health scrutiny meetings, to hear personal experiences in terms of what it's like in accessing services. So if I just to summarise, I think what you're asking, so you'd like to hear a little bit more about how to access or how we'd go about accessing NHS dentists if you can't immediately find one, and also concern about not having a sufficient of an out of hours operation in the city.
Yes.
So those are the main areas you'd like to hear about, are they?
Yes, because
your own personal experience about not finding the information easy to find when you arrived in York as well.
Right. Because I think it's kind of how to say, it's a chick. I can't say it's really a chicken and egg, but it's very strange because even though the dental surgery here under the NHS subsidy or whatever, they offer only a course of treatment. Okay, fine. I can accept that. But but on the other hand, if the dental surgery, they just simply don't accept NHS patients. I mean the new patients. Then how can we get that course of treatment? Because you know what I mean.
Yeah, very, absolutely, very good question, and we'll hopefully hear some responses from the health professionals and council officers that might be able to assist in that. So if you want to continue watching online, hopefully you'll get some of the answers. I'm not promising you'll get all the answers, and there'll not be any miracles tonight, I'm sure. But thanks very much for joining us.
Okay, thank you, Chair. Okay, thank you very much.
Thank you. Right, so that nicely takes us onto the agenda item on oral health promotion and dentistry generally. I think would probably want to talk about not just the health promotion aspects. So you'll have to bear with me for a moment. I just want to quickly run through who I believe we've got with us this evening to assist with some questions, and we've got colleagues that are in-house from the council, but also from the NHS on the ground as well. So we've got with us this evening Fiona Phillips, who's the Assistant Director for Public Health, Anita Dobson, who's the Nurse Consultant in Public Health, Philippa Press, who's a Public Health Specialist Practitioner, and we've got, let's have a look, Debbie Pattinson, who's the Dental Commissioning Lead for Yorkshire and the Humber NHS England, and Siobhan Grant, Dental Consultant in Public Health, Sean Balsam from Health Watch York, Gail Brown, who's the Chief Executive Officer for the Ebor Multi-Academy Trust, Hassan Ali Hussein, I think you're known as Naz, I hope I got that right, who's an associate dentist in York, Jeremy Boyles, who's a member of North Yorkshire Local Dental Committee and the British Dental Association General Dental Practice Committee. And I hope I haven't forgotten anyone else. If there's anyone else I've missed, if you want to wave your arm. So we've got quite a selection of people. So hopefully, perhaps if we can address some of the questions that the speaker had, first of all, if we can start with that, if there's anyone that wants to make a pitch in with a start at all. Any volunteers for opening up?
I'm not sure about addressing the questions directly, Councillor Doughty, but I'd just like to set the scene if that's okay, and then other people might want to come in if that's all right.
Yeah, thanks, Anita. Okay,
no problem. I just want to say thank you, Chair, for this opportunity to talk about oral health across York. As we've seen, it's a really important agenda item and something that's very pertinent to a lot of people across York. But I think for me, the aim of this meeting is to give assurance to people about what work's been undertaken, and also to identify those areas for improvement. And we're looking at taking a partnership and system-wide view to finding solutions. You know, we've heard from the public speaker about, you know, some difficulties. We want to find solutions, but we want to work in a system-wide way to be able to do that, to make those solutions sustainable. By understanding the needs, we can work then collectively to improve oral health. We want to improve oral health promotion, early intervention, and equitable access to dental provision. But I think we've heard just before the meeting started from one of the members that we have to acknowledge that the pandemic has magnified some of the issues that were there before. If we can remember the time before the pandemic, because time's really warped, but we had some issues, it has to be acknowledged, before that time. And I think that can be demonstrated. We've had some data from NHS Dental Statistics for England, which shows that the 2 year leading up to the 30th of June 2019, there were 92,837 adults that accessed dental provision in York. That's 54% of adults, and 27,846 children, 75%. And then in the most recent data that we've got, which is up to 30th of June last year, so the 2 years leading up to 30th of June 2021, that those figures were 79,049 adults, 45.4%, and 15,880 children, and that represents 43.4%. So we can see that the pandemic period has had an impact. You know, it's just magnified those issues. But I think we have to look forward. We have to focus now on recovery. We have to focus how we improve that, but it has to be done across a system. It's not one part of the system. We have to look at it as a whole, and we have to look at reducing those inequalities. And with permission, Councillor Doughty, CYC are responsible for the provision of oral health improvement, and I'd like to ask Philippa Press just to take us through that activity, if that's okay.
Okay, thank you.
Thank you.
Thank you, Councillor Doughty. So just there has been a report submitted, so I'm not going to go through that verbatim, but just wanted to just very briefly touch on the 5 key elements that the local authority has responsibility for. So just wanted to sort of just highlight those. So as Anita's already mentioned, we have responsibility for oral health promotion. As we know, dental decay is almost entirely preventable, and that good oral health is important for everybody from the eruption of the first tooth. However, we know that, like other diseases, people are disproportionately affected by poor oral health, and those include communities such as special educational needs, children with special educational needs, and those who are looked after by the local authority. So it is those groups that we concentrate on and look to address the inequalities that Anita's just spoken about. Another element of our our work in public health is around a biennial epidemiological survey. So all local authorities in England are required to undertake a dental survey of 5-year-olds, and this is held every other year, with the intervening year being other population groups. Although it's only the 5-year data that's noted in our public health outcomes and are those targets that were against which we are measured. Across Yorkshire and the Humber, and in fact I think across England, but certainly Yorkshire and the Humber, most local authorities have struggled to carry out that survey, which is led by NHS England and Improvement. And the last survey that we held in York was in 2018, and the next is unlikely to take place until 2024. And the reason for that is that we cannot find a provider that is able to undertake that survey. The Oral Health Advisory Group provides some of the governance around our oral health promotion work. It's a multidisciplinary, multi-agency group that works to enable us as a council to fulfil our statutory duties and address inequalities. As the paper outlined, we do have a children's oral health improvement strategy. So this was written prior to the pandemic, and the strategy does focus on the oral health improvement in children, with particular focus on those who are identified in the oral health needs assessment. So the focus on children was decided by the Oral Health Advisory Group, as it establishes social norms around oral health, has a focus on early intervention and prevention. However, the remit of the Oral Health Advisory Group is greater than that of children's dental health, and it strives to improve oral dental health across the life course. You'll hear a little bit more about flexible commissioning as other speakers come into the debate, and I don't pretend to understand the complexities of dental commissioning, and I'm sure that will be explained later by others. But this initiative focuses on those children most at risk of poor dental health, identified either by our Healthy Child Service or by Children's Social Care, and enables them to access dental care from a number of participating dentists across the city, whether they're actually patients on those lists or not. So finally, I'd just like to ask Scrutiny to note the content of the full report that we submitted and to support the oral health promotion strategy and implementation of that wherever they can. Thank you, Chair.
Thank you, Philippa. Before I go to members' questions to kind of start the ball rolling with discussion, I have something that I probably want to ask Debbie Pattinson, who's the dental commissioning lead, and it's in connection with one of the supplements we had on the stakeholder update. And in there it says, once the NHS emerges safely from the ongoing COVID-19 pandemic, our intention is to continue with this work to improve general access and reduce inequalities where possible. Now, obviously, how we've seen in the Health Watch report as well, that the access to dentistry in York, it's not a new issue. It's been exacerbated greatly by COVID, clearly, but it was already an issue long before, and there's no real sign of that it will be improving anytime soon. And linking back to what the questions that the speaker had, how do we, what plans are there to improve access to dentistry for people that require or want an NHS access to dentistry? What would you say we're doing positively, Debbie, in the city?
Thank you. I'll come in. If I could just take the opportunity, first of all, to say thank you for inviting me, and also if I can just have a little bit of 2 minutes of your time to run through key things in the paper.
Yeah, sure. Yeah.
I welcomed your comment earlier that where you said we won't have all the answers this evening, because we won't, but I can at least articulate some of the challenges from a commissioning perspective, as well as understanding them from a patient's point of view as well. So just take a little bit of time to run through the delivery model. focusing on primary care, which is all dentistry has been impacted by the pandemic, including secondary care, where staff teams once working on oral surgery and orthodontics and paediatrics were realigned to ICUs and other high-risk areas within the trust, something that was a national model. Primary care is also a national model. So the Chief Dental Officer mandated on the 24th of March that all dental practices closed, and that's 2020. And there was an ask of regional commissioning teams that we set up urgent care centres. It's important to go back, I think, as far as March 2020, because we've still got a backlog that goes back that far. So taking into account the fact that access to dentistry pre-24th of March may have been an issue in York, it's certainly been exacerbated through closing down practices. The activity levels are important to highlight, because dentistry is, I think Siobhan may come in and help me with this from our dental consultant. I believe there was a study that said that primary care practices were the second highest risk for transmitting COVID infections after an ICU. Now, that's to do with the fact that most treatments generate aerosol generating procedures, and the airborne particles mean that the infection rates are a lot higher. So we had to make sure that patients and staff teams were safe. We had trouble getting PPE to practices, but ultimately we eventually did. From June 2020, practices were asked to open, and for full income protection had to deliver 20% of their pre-COVID appointments. That has been increasing quarter on quarter, and it went up from 20% to 45 to 60 to 65, and it's currently 85%, albeit feedback we're getting is that practices have been struggling to deliver that level of appointments due to staff absences. You'll have seen on the news about how teams, especially small practices, which ultimately an infection closes down the practice. So I think it's important to declare the full income protection, because our budget is fully committed. There is no sort of scope to reinvest funding. And I think whilst we recognise the national model and the current delivery model at 85% is still impacting on services, what we had to do nationally was ask practices to focus on prioritising callers. So the clinicians within practices were asked to clinically prioritise the urgent dental need of the callers. And anyone who was classified as having an urgent need should still be getting an appointment, albeit we do hear not all practices are able to do that. What that means is that there's very little regular and routine dentistry out there. So urgents remain the priority, and then access to vulnerable groups is the next ask of practices, and then if they have capacity, regular and routine care. The issue there is we understand that means it's really, really challenging for patients to access a routine appointment. We hope that accessing urgent care is not as big an issue, but the ask of practices is that they prioritise those people in dental pain into the chair. If we do hear practices aren't working to that, we often ring practices directly and remind them of the national delivery model at this time. Just looking at my notes. So when we're supporting practices to maximise their clinical activity, so long as it is safe for them to do so. And when we are looking at, we've got a number of work streams that are going to be implemented across Yorkshire and the Humber, which were in the report. And there is also some specific to York, which does include the out of hours urgent care, which we see as an issue for the City of York. We have tried to implement an out of hours urgent care twice in the last 4 years, but we didn't get any providers willing to take the contract. We'll be looking at that again, Saturdays and Sunday mornings. At the moment, the nearest providers we're contracting with is, as the earlier speaker said, is in Harrogate, or it's going to be Hull. We know that's not acceptable, and we will try to re-procure a new service out of hours, and it is a priority for us. Unfortunately, the track record so far is that we don't get any bids. so we'll see what we can do with that. It's certainly a priority. There's another couple of areas in the dental pathway that also aren't covered in York, and again they are going to be subject to procurements, and that is a community oral surgery service, a specialist service where a patient doesn't need to be seen in York Trust, can be seen in a specialist centre. We'll be looking at procuring a service for York over the course of the next 12 months. And we're also speaking to the Trust about expanding the services they offer when they can, so that the service at York Trust is comparable to some of the other trusts across Yorkshire and the Humber. So we're definitely looking at working at that, And I think it was Philippa that mentioned flexible commissioning. So a little bit of a summary of flexible commissioning, which is, as I mentioned before, all of the funding NHS England gets for dentistry is committed to existing contracts. And that is a challenge in itself, because the primary care contracts were established in 2006 and remain in place, and they don't have an end date. So they are a national contract, which we can only extrapolate from if there are significant delivery concerns. I'm not aware of any other contracts in health and social care that don't have end dates. So they're national contracts, and we can't do anything with moving activity where we think it is most needed whilst those contracts are in place. But what we have done as a region is we've looked at what we call flexible commissioning, and we were one of the first regions to implement this a couple of years ago, albeit it's now been deferred whilst we're supporting practices to deliver more appointments. That is where we give the practice, contracts for dental care are based on a tariff of activity, which is different to GP lists. So a GP practice is contracted on a number of patients. Dentistry is on activity. So what we did was we came up with a plan, which was to convert some of the activity back into a funding stream, and we give practices that were willing and eligible to join the scheme a resource envelope, financial envelope, and then they can deliver services by dental care professionals, basically based around oral health initiatives or group sessions such as supervised toothbrushing. It also promotes a signposting element, which has also been referenced before. So maybe a looked after child not able to get into dentistry, where we're sharing flexible commissioning practices with health and social care professionals so that they can signpost patients in almost a little bit of a fast track. The reason why we have to do that is the contract stipulates that activity in a primary care contract can only be delivered by a dentist. So if we turn some of the activity into funding, then dental hygienists and nurses can actually deliver services and not have them delivered solely through the dentist. So we're trying, that's the flexible commissioning definition. We have plans for 2 phases of flexible commissioning. Phase 1 was rolled out, and out of 19 or 20 practices in York, only 5 were willing to take part in that scheme. And we also had phase 2 lined up. And phase 2 was where we were going to put a business case in to try to secure some additional funding to expand that service to target hard to reach or hard to engage patients. But since March 2020, the financial regime at NHS England has shut down, and we're not able to access any additional funding. And that's national, it's been led by the national team. We still have the commitment to pick that up. It's certainly on the Yorkshire and Humber work plan and our dental strategy. So I think just on the back of some other challenges there is the fact that, you know, NHS England is nationally led at the moment with finances and budgets. All of the funding we have is committed. The contract itself is the biggest challenge, I would say, as a commissioner who's worked in a number of different remits, and having a contract in perpetuity where you can't test the market is not always helpful. And the other thing that is a big significant challenge at the moment, which you'll be hearing about on the news, is workforce retention for practices. So practices employ their own staff teams. They determine how many dentists and dental care professionals they need to deliver the activity in the contract. NHS England doesn't keep records of staff teams, and Health Education England are the lead for supporting practices with recruitment and retention, and we support Health Education England with that. I think it's fair to say the feedback we are getting at the moment, and we have been getting actually for quite some time now, although the pandemic has exacerbated it, is that dentists are leaving the profession. Dentists want to work part-time rather than full-time, and at the moment, given probably some of the patients calling in distress, trying to get an appointment, lots of front of house members of dental teams are leaving too. Receptionists, administrators, dental nurses, we are hearing that there is a lot of people choosing to leave the dental profession and seek work elsewhere. We don't have numbers for that, so it is the feedback that we're getting. So that further exacerbates the issues with practices being able to deliver appointments. We are waiting for what the delivery model might look like from the 1st of April next year. And I think it's fair to say, whilst we've got a lot of things on our work plan that we can improve services in York, such as urgent care out of hours, access itself, it is really problematic in a national model that we're implementing locally. So I'm really sorry that doesn't answer the questions, but I hope it gives you a little bit of understanding that we are empathetic or empathic with the patient's challenges at the moment accessing care.
Right. Just before I go to Councillor Bassey, there's just a couple of things I just want to pick up on what you've said, Debbie. And one of them, it might be a very simplistic view, but to change these contracts, do we need the Department of Health to intervene?
It isn't something that we could influence. It is a nationally set model, yeah. So there has been, I've been at NHS England for 5 years, and I think it is, it's not a disrespectful, or but for 5 years there's been talk of dental contract reform. As far as I understand it, there is a national group set up to look at dental contract reform, and there's been a new team set up, a central team at NHS England looking at this, but it is they'd have to change the regulations and the policy book, all of the things that are governed nationally. So it is a national concern that the dental contract in itself would have to be terminated and a new one put in place as such.
Okay, thank you. And then you referred to assisted toothbrushing, I think referencing children specifically for, I'm guessing, largely preventative dental care. And in the reports, I forget which page it is, but I did read that the service had to be suspended due to the finance restraint. So I just wondered what your thoughts there. Where is the difference between oral health prevention and where it becomes potentially a child safeguarding issue? You know, if it's specifically for some children within certain, shall we say, deprived settings, perhaps not necessarily, but that might be it might be looked after children. There'll be a whole host of different categories, I guess. But what would you say to that?
We haven't suspended any services. So any practice that's got flexible commissioning phase 1, they should be continuing with the flexible commissioning for phase 1. We certainly haven't suspended any schemes that did join the flexible commissioning, and they should be continuing.
Fiona, was that something that we were doing as a public health team in York then?
Yes, I don't know. I think that was in Anita's paper that you've read that bit. I don't know if you want to explain that, Anita, the issue with that.
Yeah, either me or Philippa. So the financial envelope to deliver on assisted brushing were tight, and we weren't able to deliver that. We are looking to find other monies to be able to reinstate that. And that may come back into play. I think when you talk about poor oral health being a safeguarding issue, we've talked about that at length in York. When I first came to York 5 years ago on the neglect committee, on the neglect subgroup, but oral health as a standalone would not be a safeguarding issue. It would be a collection of things that impacted on that child. What we aim to do for oral health promotion, and certainly from a children's perspective, that very early help, is look at oral health as a social norm. It gets embedded in that something that we do as a family, something that a child does and then carries on into adulthood. And that's the thing that we're trying to achieve through assisted brushing and promoting of brushing twice a day, and when applicable, a dental visit. So we are looking to reinstate these things quite quickly.
Okay, we'll go to Councillor Vassie next, please.
Thank you, Chair. I've got a lot to say on this personally myself, but I want to use this first spot just to quote a sentence from 8 of the people who contacted me in my ward over the weekend on this issue. The first one: we've lived in York 11 years. I've just had a baby. I'm entitled to free dentistry on the NHS postpartum, but there is nowhere in York that will see me. Another person: I've lived here nearly 10 years and still have to go to the dentist in Ilkley. I've been unable to find an NHS dentist in York. Another person: we use my dentist in Pocklington. My disabled husband hasn't seen the dentist for some time and has no idea when he will have a checkup because he's a wheelchair user and cannot access the upstairs surgery. Another person: I ended up in an emergency department in Doncaster, and that dentist said everyone travels there just for checkups from York, still not got a dentist. Another person said, my dentist won't see my 2-year-old son as he was seen a year ago and that's deemed adequate by them currently. Another person said, I booked with my dentist for a checkup when they opened again. Appointments were cancelled twice. Then I was told the dentist does not do NHS anymore and they are recruiting now to find a new dentist, so I'm waiting. Same for my son, Ben. We haven't had any checkups since COVID. And a last couple: my wife and I chose to stay at our Leeds dentist until after the pandemic. We had a baby in July 21 and have recently tried to register him. I called 10 dentists in York, but couldn't get him registered. The waiting lists are closed, or waiting times are up to 5 years. And the last one I'll give you is: an acquaintance of mine was told that the nearest emergency NHS treatment available was in Scarborough. It's scandalous.
Thank you, Christian. Did you have a question now, or do you want to hold?
I do eventually, but I wanted us to hear the voices of
That's
residents in my ward. I'm not blaming anyone here for what's happening, but what is happening is a crisis. And I want us to remember that all these people are individuals, young and old, with challenges that are presented as a result of where we are in dentistry today.
Thanks, Councillor Vassie. And I think some of the statements that you read there probably reflect some of the points made in the Health Watch report that Sean probably wants to speak a little bit about in a short while. There are a couple of people, well, there's several councillors that want to speak, but I noticed that Siobhan Grant, who's a dental consultant in public health, had her hand raised, and Gail Brown as well. So I just wonder whether, Siobhan, did you want to speak next, and then I'll ask Gail first, and then we'll move on to other members.
Thanks, Chair. So good evening, everybody. I am a dentist by background. I've come from Public Health England, and it was just to address some of the points that people had raised. I think the first to say is that it is still shocking to me as a dentist that the #1 cause for admission for children to hospital is for extraction of teeth under general anaesthetic. For 5 to 9-year-olds. But the good news is we know what works in terms of prevention, and we know which groups are most affected. So there was a question there about supervised toothbrushing schemes. So they would have been the local authority schemes, and some of the schools and nurseries continued with those, and some of the special schools. They were suspended during COVID, but some of them moved to a dry the flexible commissioning practices, that they've been focusing on prevention and again on a risk-based approach for those most in need. And to just go back to what Debbie was saying about some of the challenges that dental practices have had. I know we've got some dentists on the call who are actually at the enamel face, so to speak, with the challenges, and they have had lots of difficulties in terms of staff isolating. And anytime you pick up a drill, it creates an aerosol. So they were obliged to follow infection prevention control protocols and have a 30-minute fallow time where they couldn't bring another patient into the surgery while all the aerosol settled. That has got slightly shorter as mechanical ventilation has been brought on board to bring that down, and they had to socially distance patients as well. They are independent contractors, and they were asked to prioritise those in greatest need, which is why a lot of the recalls were pushed back. Now, they should have been prioritising those at greatest risk of disease or those with urgent care. And we might hear from some of the dentists later on that.
Thank you, Siobhan. Gail Brown, please, who's the Chief Executive Officer for the Ebor Multi-Academy Trust. Good evening, Gail.
Hi, Councillor Doherty. I just wanted to say, although I represent Ebor, I'm here today to represent all the primary schools across York. So I did a quick poll across all our primary schools and asked our nursery and reception teachers three key questions. One were nursery and reception staff concerned about dental health of the children that they were seeing, so 3 to 5 year olds. The second was, had the staff had to speak to parents, or had they had to raise concerns about anything to do with dental health, which you might think is a strange thing to raise with parents when we're educationalists. But also, had parents raised concerns with staff? And it won't come to any surprise, and particularly when we've heard concerns from the speakers and the residents, that actually in our most disadvantaged areas and in the schools which serve our most disadvantaged areas, this is a real area of concern. So staff reporting children and just young as 4 and 5 having up to 8 teeth extracted, huge amounts of dental decay, real concerns, lots of issues around oral health. Some of that is health around and education around use of dummies. So that is part of it. But I think a huge piece of work, and I think it was just something to report back that it is a concern. It is raised by parents, staff helping parents try and get emergency appointments, sometimes successfully, sometimes not successfully. But I think it's really important to know that is filtering into the school system as well. So I just wanted to report that back, really.
Thanks very much, Gail. I appreciate you joining us tonight, and obviously you're welcome to pitch in at any point if there's anything you want to ask or you want to make any further comment on as the discussion goes. You'd probably be interested in our later item as well, childhood obesity. I don't know whether you'd had an opportunity to see that on the agenda, but you'd be more than welcome to stay for that. And I don't know whether you've had a chance to look to see that, but you'd be very welcome to stay for that. I appreciate you probably had a long day already, but thank you very much.
Thank you.
We'll go to Councillor Taylor first, please, and then Councillor Hook.
Thank you, Chair. I think Councillor Hook was just before me, to be fair, if that's a big deal. She seems relaxed.
Now you're speaking, just go for it, and I'm sure I'll give you a kicking for later on. But
Cool, thank you. I just want to thank everyone for being here tonight as well. The turnout is incredible, and it, how do I put it? It communicates to me a shared sense of frustration Councillor Vassie was right to sort of stress that the criticisms he's raised are not about any of you guys in the room. This is it's a depressing disgrace to look at this picture and hear professionals who will have got into this area of work for their own passions and interests describe it in the ways that you are. And I do admire those in the room who are trying to highlight the positives too, despite how bleak things are. I do have 3 or 4 questions, Chair. Now, reel them all off in one, and we'll hope to get through them, or I can do whatever you prefer.
Well, if you think they're going to be fairly quick answers to each one, that's fair enough. But if you think it might want more detail from people, then you might want to do them individually. Whatever you think.
All right, I think they're fairly simple. The first one should hopefully be simple. It relates to the epidemiology survey. I think I pronounced that right. We received a comment before to suggest that this will be done in 2024. Can I ask what's giving us that sense of confidence on that date?
Purely because we have had ongoing conversations across the region. It has been identified as an issue across Yorkshire and Humber, and colleagues of Siobhan's have taken that on, and we're looking at a much more sustainable provision of provider, whether that's on a wider geography rather than each local authority trying to take it on individually, but actually can we look at it as a Humber, Yorkshire and Humber wide issue, and deal with it in that way. So we're just looking at different models of rolling that out, really.
Yeah, if I can come in as well, Councillor Taylor, on that, we're also in a, we're looking beyond the pandemic. We know that the pandemic has impacted, as we've heard, on dentist provision, but also on NHS provision across the piece. So as we move towards recovery, and we've got that 2024 date in mind, it's much more likely that a provider will have the capacity to be able to deliver.
Let's hope so. Thanks for those answers. Chair, I'll just ask one more question for now, actually. Thank you for your patience with me. It relates to this flexible commissioning concept. Forgive me if I've got it slightly wrong, but I think within that there was an idea that some courses of treatment could be, if you like, passed on to nurses and dental hygienists to try and help deal with more demand. Forgive me if I've got that slightly wrong, but if I've got that right, my first thoughts were, and I don't mean to be sort of blunt here, the first thoughts were, hang on a minute, aren't nurses massively overstretched and leaving the healthcare sector as well? And I'm sure dental hygienists under a lot of pressure too. And it just feels like best endeavours, making use of resources that are available, that aren't really going to crack the problem, because sadly, we need more staff, they need to be kept, and we need many more places where people can get treatment. Was that what you were getting at with flexible commissioning, or have I misunderstood?
I'll come in, and maybe Siobhan might be able to help if I don't get the full service model right. It's not it's slightly right, but what we've decided to do with flexible commissioning is that because dentists are responsible for all of the units of dental activity, the UDAs and the courses of treatment, putting flexible commissioning in means that nurses and hygienists who can work to dentists by delivering some treatments that maybe aren't as complex, and also are looking at oral health initiatives. So it's not solely about treating, providing a course of treatment. It's about doing some of the supplementary bits of work that then means that a dentist could perhaps focus on the more clinically advanced treatments that are required. It's not just about a one-on-one either. So what we were looking at was things like, our aspiration was that we could have dental nurses having, maybe, I'm making this up, Tuesday afternoon, it's a drop-in, and we could then have people signpost into those sessions, and a nurse could speak to a number of patients in one go rather than just one patient. Siobhan, in terms of the clinical elements of, you'll know more in terms of what can and can't be delivered by dentists and what can be delivered by hygienists. Because hygienists do support delivery of the contracts as well. Nurses don't, but hygienists do. So it might be that you get polish and a scrape, you know, pre-COVID, you get a checkup by a dentist, but the hygienist undertakes NHS and non-NHS cleaning of the teeth. Siobhan, have I missed anything obvious in that flexible commissioning?
We're probably getting into the realms of what different dental staff can do. So a hygienist you'll probably be familiar with from your own visits to the dentist. So they do the scales and polishes and cleaning the teeth. Therapists are slightly different. They're a category that can work under the prescription of the dentist to do simple treatments. But what we're talking about here with flexible commissioning is, as Debbie said, freeing the dentist up to do other more complicated things, but it's using the dental nurses, and it's to give preventive advice. And also, as I said before, we know what works in terms of prevention. So fluoride varnish is really important in those children who are most at risk of disease. And wider than that, giving preventive advice. So things like frequency of trying to reduce the frequency of sugar, the amount of sugar, brushing particularly last thing at night because your mouth dries overnight. So giving those messages and trying to stop the flow of disease before it starts, particularly in those children who are at high risk. So it's taking the nurses into an oral health champion role. We're talking quite a lot about children here because that's very emotive, but also we know York's got an aging population. So what I would call the heavy metal generation. So we've got people who are older, who have lots of metal fillings, who are finding it increasingly difficult, maybe with different other conditions, to keep their teeth clean. They may be on lots of different pharmacy drugs that dry the mouth. So we know there's lots of problems there. So it's not just children. It's about giving those preventive messages and showing people how to clean their teeth properly, giving them fluoride varnish, maybe identifying the heavy smokers and heavy drinkers who might be more at risk of oral cancer. So it's trying to stop the flow of disease before it gets there in those groups that are at high risk.
Thank you. Right, Councillor Hook next, please.
Thank you, Chair. Just one question, it's probably a technical thing, but I know there's limited funds because the amount of money available for that NHS dentist was set in 2005 and the population's risen since. But I wondered, when a dentist's practice stops doing NHS care, is there a system for moving that money that they would otherwise have had to someone else who wants to start doing it? Does that work fairly seamlessly, or does funds get held up and diverted? That's the first question.
There's not a national, there isn't a national NHS England approach to that, but in Yorkshire and the Humber we have introduced a formal system that takes into account procurement regs and our internal standing financial instructions, but actually our key focus is to keep the funding in the constituency from which it has been returned. So I'm thinking about examples close to York, because there hasn't been any funding handed back from any contractors in York. But for example, a tangible example is in the Selby and Ainsty constituency, where we recently had 2 contracts deciding to focus on private care only. Contracts come back to us, and we look at reinvesting that funding in the Selby and Ainsty constituency. And if it's a huge constituency, we break it down into wards and we offer the activity to other NHS providers who are delivering their contract. So we say willing and eligible. So our key focus is always to keep the funding in the constituency from which it has been returned.
Yeah. And the other thing was that someone once said to me that newly qualified dentists had to have a bit of NHS time to get qualified, and I don't know if that's true and whether that was a potential source of new dentists.
Yes.
Shall I pick that one up?
Thank you.
What you're talking about there is dentists go through something called a foundation dentistry scheme. So anybody that wants to have an NHS performers number to go on an NHS list, which means they can practice NHS dentistry, has to have a certificate to say that they've completed foundation dentistry or the equivalent, and that usually takes a year. There's a slightly different scheme for overseas dentists, but it's an equivalent scheme. So it's all managed by what we used to call the Deanery, but Health Education England. That doesn't apply to private dentistry.
Yeah. So if they wanted to go straight into private, you don't get that year in public.
So yeah, they may well have done foundation dentistry, but they could technically go straight from dental school or from an overseas qualifying examination into private practice. Correct.
Thank you.
Thank you. Councillor Heaton had your hand raised before. It's not down, not still up. Was your question answered by what the speaker said, perhaps? Or
it wasn't, but I think Councillor Vassie was there before me, so I'm happy to yield to him at the moment.
Okay, that's fine. Councillor Vassie then.
Thank you, Chair. My first question relates to the question raised by Councillor Hook just a minute, her first question. And it's about the relationship between NHS patients and dental practices. When I've sat down and talked about this with my dentist, and I'm one of those people who can't find an NHS dentist, it was explained to me that when a dental practice is sold, the NHS patients go with the sale, but if the dental practice closes, the NHS patients disappear. So my first question was, is that correct? Is that what's happening? Is that a reason why, or does that contribute to a growing problem for people who want to access NHS dentistry?
So there's a little bit of truth in both of those statements. But there hasn't been any contract terminations or handbacks in York in the last 5 years, and my records only go back 5 years. So NHS practices that are currently in place may have been sold, may have changed hands. The practice may have changed hands, but there's certainly been no closures. The issue we have with the dental contracts and the patient list is that in reality, a patient list doesn't exist at a dental practice in the same way that it does at a GP service, because the contract stipulates that the practice only has to complete a course of treatment and doesn't have doesn't mandate ongoing regular treatment. What happens in reality, though, is most practices have a list of regular patients who they recall according to NICE guidelines. So I've got a practice in town, in Old Walk, and at the moment I'm being recalled for regular care. Now I'm grabbing that with both hands, given what we've been hearing about access to regular care at the moment. So a patient list doesn't ordinarily transfer when a practice closes down. What we tend to do if a practice, so we've got some examples in other parts of Yorkshire and Humber, if a practice closes down, the practice doesn't have any ongoing relationship with that patient list. What we tend to do is we are not constituted to keep patient identifiable information. So there is an external organisation contracted by NHS England, and we tend to find out who accessed that practice in the previous 12 months, and we arrange for a letter to go to those patients telling them how they may be able to access dental care. The challenge there is a patient list is not transferred, and patient files are not transferred in the same way as a GP. So if a patient would have to access their own dental records, request them and take them to a new practice. What tends to happen is when they get a new dentist, they'll have a new assessment, and that new dentist will start a new case record.
That's a very interesting point, to make sure I've understood it. So if someone has an NHS dentist previously, they're now wanting to access NHS dentistry going forwards. Is there something that you're saying that the local authority might do to help, or the NHS to do, to help patients find those dental records in order to be able to demonstrate to others that they are indeed an NHS patient? Is there something that we could be doing, either as a local authority or as the NHS, to assist people?
Well, if somebody was accessing a dentist regularly prior to March 20, the practice should maintain that relationship when they have regular appointments available to recall people. But at the moment, all practices should be prioritising urgent care only. Ultimately, after that, it's, you know, there isn't really anything, I don't think, that can help. We're certainly speaking to practices who are saying they're no longer seeing people, but it's for the practice to determine their patient list, and that's things around zero policy. There may be an irretrievable breakdown between the patient and the provider, but they're few and far between. But ultimately, a regular relationship is between the practice and the patient. If a patient is moving, they may opt to take to ask for their dental records that, moving down south, they take with them. But NHS England doesn't own the patient record, so we'd not be able to intervene. I'm not sure if that's helping clarify.
A little bit. So if I've understood correctly, I'm just wanting to make sure I've understood so that any people looking in would understand. So if I'm a patient who was with an NHS dentist in 2019 before the pandemic struck, do I have the right to go to that dental practice and say, can I have a copy of my records? Yes. Because I hear from people saying, well, because I've not been for 2 years, people are saying you're no longer an NHS patient. And of course, COVID is all wrapped up in that. So it would be good to have clarity about whether as an NHS patient, you have a right to ask the practice for your records.
You certainly do, not under an NHS England contract, but under the general data protection regulations. You have the right to seek information that is stored by anybody about you, but that would be, they'd have to put in, I think they have to put it in a request in writing, and then the practice under GDPR would have a certain amount of time to respond to that request.
Thank you. Can I ask one more question, Chair? Or
yeah, certainly.
I don't know if all of us have managed to see the Health Watch report. I think it's shocking. The statistics are just one page after another of, of the people who don't have access to a dentist. In the survey they conducted, 71% say they can't find one. And the list goes on and on and on and on. And I'm sure it's depressing reading to all of us, and maybe most particularly to all you who are professionals. But at the end, it tries to engage with solutions. And obviously that's part of what we want to do here today. There's talk on page 57, 58 of the report about reform of the way dentistry is commissioned, and various other things. And there's nothing spoken in it about cost. And obviously everything that we do and everything we talk about here comes down to cost. I was wondering if the professionals here today, if they're within York, anyone has tried to assess what it would cost to turn this around in our city so that we can make a case to government to say, we all know what our crisis is. It's a national one. In York, we've actually tried to understand what it would take to unpack this. And I know with my own dentist, he's explained to me that the challenge for him is that he's currently subsidizing every NHS patient he sees. And it's come to a point where he just says, I can't take any more people on because I've got to protect my business. And he mentions a lot of the things that these speakers have said about retention of skilled staff, et cetera, et cetera. So I'd really like to have an idea whether the professionals here have been thinking about what would it cost to put this right and how we might go about doing that. If we haven't done it, what it would take to do that.
Thank you, Councillor Vassey. Can we go to Jeremy Boyles, please, who's a member of North Yorkshire Local Dental Committee and the British Dental Association General Dental Practice Committee. I don't know whether you wanted to speak directly in answer to Councillor Vassey's question, or whether it was something ahead of that, Jeremy.
Thanks, Chair, for letting me speak. Yeah, I will answer one thing in relation to Councillor Bassey's question, and I'll come on to that. But I did want to make a couple of points already, which fit in with the current discussion. And one is about the sort of failed dental contract that we have. The Government Health Select Committee in July 2008 declared the current contract that we still have unfit for purpose. And yet we're still going on with that. And dental contract reform started in January 2009. And those prototypes are now ending in spring of this year. And we're still no closer to a new dental contract after all those years of pilots and 3 phases of dental contract reform. So we're back to square one. The problem with the dental funding is that there isn't enough money in the current NHS dental budget to pay for NHS dental provision for every single person in the UK. So the current dental budget is £3.2 billion. And that dental budget has not increased since 2006. So there's been a real terms cut in the funding for dentistry since then. And even with that £3.2 billion, that only commissions enough dentistry for 51 to 53% of the UK population. So even if everybody wanted to be seen by an NHS dentist and there were enough NHS dentists to do that, the money just wouldn't be there to pay them to do it. And, you know, it must be mentioned that, the government enforce charges for NHS patients. So NHS dental care is not free at the point of access, like care is when you see your GP. So dental charges were introduced in, I think, 1951 by the then Labour government to pay for the Korean War, and they've still not gone away. So of that £3.2 billion, the government charges, or makes the practices charge a certain amount of money from patients. And so the PCR, the patient charge revenue, is £753 million. So that's money that the government is essentially getting like as tax back from patients who access NHS dental care. Unless, of course, those patients are exempt or children, in which case their care is completely subsidised. So I think that's one of the issues, that I think more funding should be available for dentistry. And I think one of the reasons we're struggling with recruitment for NHS dentists is the contract itself. And I don't know how many people have aware of this, but we're paid with UDAs, units of dental activity. And a unit of dental activity is earned for doing certain things. And there's 4 bands of that. But if you have a patient who comes in, a new patient to the practice, for example, and they need a checkup, whatever, you do your checkup, and then they need 4 fillings, an extraction, a root canal treatment, and the denture addition, you get paid the exact same amount as if you just did 1 filling on that patient. So there is absolutely zero incentive to take on a high needs patient financially for a dental practice. Why would you take on a new patient and get paid 3 UDAs to do, 4 fillings of root canal treatment and extraction and a denture addition? It's not financially viable. 1 UDA, it says in the Health Watch report, I think is about £30 an average for York. So 30 times 3. So that's £90 that the practice is being paid for possibly 3 hours of work plus a lab fee. And that's just not sustainable. It's not affordable. You can't pay a dentist, dental nurse, reception, business rates, electricity costs. You just can't do that all from that amount of funding. And so the contract definitely needs to be reformed. So yeah, they were the main points I was making. In terms of Councillor Vassey's point about where the funding that would be needed, I mean, you probably have to double the dental budget if it only pays for 51 to 53% of the population to access dental care as it stands. I think a lot more money is needed, and I'm sure that is beyond what York can achieve. But I think it's definitely something that needs to be fed back to the higher powers.
Thank you, Jeremy. Well, I guess what you say about that 51, 53% equates to my own personal experience. I am a registered NHS patient with a dental practice in York. It's not where I currently live. It's from when I lived on the other side of the city. I'm grateful to still be able to attend there, and I'm lucky enough to be able to access and travel, perhaps not having the difficulty that some people might have to access. But after 2 years, I decided, with this meeting in mind, I guess prompted me to make a call to the dentist, because I deliberately stayed clear essentially from the start of COVID. So it's over 2 years since I had a checkup. And I was pleasantly surprised that they offered me an appointment around about 2 weeks from my phone call. I wasn't available that week, but I got a slot for the following week. So I'm due to go very soon. Obviously, that's a checkup, but if I wanted to see the hygienist, then I was told that I would have to pay privately for that. And my circumstances are that that's not an issue, but I appreciate that's not the same for everyone. But I guess that almost equates to the half cost that you're referring to in some ways, and that's my own experience. Christian, is there anything else you want to say in connection with your
at the moment? No, that's fine. I'm really pleased that Jeremy set out the situation from the dentist's point of view, and I personally think that while obviously we're talking about oral health and the local authorities' role in maintaining oral health, what is absolutely clear to me from reading that report and from hearing people like Jeremy and the other people who've spoken this evening is that this is much bigger than that. Yes, we have a role in making sure children learn to brush their teeth, and that is serious, and obviously I have that in my own family. But the crisis facing us is of long standing, and I think what the figures Jeremy has given us, I would like to suggest, Chair, when we come to producing a report on what we're learning here today, we need to make sure we don't become too internalized and focused on those things we can do here, and actually look up and see the scale of the problem and communicate with government the seriousness of this situation for the long-term dental health and broader health issues of the entire population, frankly. So thank you.
Thank you, Councillor Bassey. Can I go to Hassan Ali Hussein next, please?
Yep, so Naz is fine. It's just what everybody knows me as.
Thank you.
I'd just like to follow on from Jeremy's points, really. So I'd like to say thank you also for having me here and for allowing me the opportunity to speak, Chair. Really, from what Jeremy was saying, a lot of the issues that stem from NHS dentistry, he is quite right, are to do with the failed contract. It's not an easy contract to work in. It's very demanding. It is very performance-based. And what I'd like to say is that there's been a lot of questions raised in terms of understanding, or perhaps how the contract works, or how practices have to function and adapt, or find ways of actually fitting in with what the contract does for them. I did actually write a blog, which is available for public viewing online, which went as an 8-part piece. It started during COVID, but it was really about why, practices are sort of converting from the NHS, why they're finding it difficult. And I could put the link in the chat if anybody wants to read it. Hopefully it will actually help sum up your questions as to what dental practices need to do, or ways that dental practices can actually find solutions, or how you can help support dental practice to find those solutions to improve access to NHS patients.
Thanks very much, Naz. What would be really good if perhaps you could drop a line to the officer with the link by email, and then we can circulate around members. But that might be something to add to the minutes potentially. I'm just conscious that obviously the public can't see chat, and obviously if you've got suggestions to make, then it would be better that it was in the open. I think. Thanks very much.
No, that's what. Can I ask which email would you like me to respond or to send that to?
I think, Louise, could you pick pick that up with Naz afterwards?
Yeah, I'm just actually private messaging you, Naz, with my email address, so I'll send that to you.
Can I make a final point as well, actually, which is something that's not been mentioned and something that I didn't mention in my blog. So I approached Right Honourable Rachel Maskell quite a few years ago now, explaining how this must have been going back 2016 or 2017, explained to her that dental provision in York was terrible back then. And at that point, I wasn't really active very much with the local dental committees or in sort of local dental groups in general. So my solution to her was that I did present her an idea about how maybe not to improve access as such, but maybe actually at least try and improve healthcare and prevention, especially for children. Disappointingly, she went to NHS England, who very much dismissed my idea and came up with a wish-wash answer. And ever since then, for the past few years, it just seems to have been that the government are essentially just trying to ignore things and not necessarily saying that they're not able to provide any NHS dental care. But strangely enough, it just seems to be the same answer that you hear every time on PMQs, which is literally, yes, we have increased NHS funding. Yes, the dentists or the dental profession will be ably supported, and they sit back down again and they don't actually say anything more after that. And I think Jeremy will probably agree with me is that money is, always promised, or we are always told that there is more money available. It just never comes. And without any extra funding whatsoever, our hands are completely tied and we can't do anything more beyond that.
Okay, thank you, Naz, for your comments. Councillor Heaton next, please.
Thank you. Just looking at the sort of like wider strategic level of it. So the Oral Health Advisory Group, which is paragraph 13 in Annex 1. It's talking about the composition of it there. So it's talking about the CCGs. How does that change when the new ICS comes in? Has there been any sort of confirmation as to how that will be arranged when that's all in place? Well, potentially in the summer.
Yeah, sorry, I'll get myself off mute. Yes, so we have had that conversation and they have promised representation still to come. Obviously, they don't know who that will be, but yeah, that's certainly on the agenda for the ICS.
Great. And in terms of the ICS involvement there, when we're looking at the contract, and obviously, I was going to ask about progress on the contract, but it sounds like it's difficult is one word to describe it. When we're talking about the ICS and look, the strategic element and the role with the providers, is there any indication that the sort of like development of the ICS system, not necessarily speaking directly to our ICS, but the development of the ICS system will be able to help in any way in terms of those contracts, in terms of sort of strategic deployment there?
So I wonder if I could just come in. I'm pleased you've raised this issue, Councillor, because although we've heard a lot about the sharp face of the difficulties with accessing dentistry and the provision of dentistry, it is a system-wide approach, and it goes far beyond just toothbrushing. We talk, the sugar consumption. We've heard about prolonged dummy use, etc., influencing a negative impact on children's oral health. But to answer your question, the push from secondary care, we've heard that the biggest admission for children is for dental extractions. So having secondary care talk to primary care and looking at solutions at that end is also an issue as well. That's something that needs to be done. So at that meeting, that's the Oral Health Improvement Advisory Group, that's where those discussions need to happen so that the system is joined up. So we've heard about the very, very acute end, the dentistry, but we have to talk about provision. We have to talk about different providers having conversations, and it's something that I've been involved in for a long time. When a patient's discharged from secondary care, what is the follow-up? What is the prevention advice? What is to stop that patient being admitted again for dental extractions under general anaesthetic, and especially children, although not only children. So there is something about having that forum for all those partners to look at that system-wide approach. But you're absolutely right to raise it, and I thank you for that.
No, thank you. And in terms of, one of the things that you see with ICS is a big focus on health inequalities, isn't it? Particularly as they're starting up. And so is there something to be said for that being something that, on an ICS by ICS basis could be used in terms of, that's coordination element across the region?
Absolutely, and I think that's the core of it, because that's where we see, the very severest cases. That's where we need to do most of the prevention. So you're absolutely right. What does it look like on that wider footprint? Now, obviously, the ICSs are just coming into fruition. They're finding the feet. We've heard from Philippa to say we've got assurance that we will have representation, and we'll be making sure that that happens. But what it looks like on that wider footprint, I don't suppose they know yet, to be honest with you. And I think it's up to us to keep the momentum going on that.
Yeah, thank you.
Thank you. I've got Deborah Patterson, please, then Councillor Vassie, I think.
Thank you. It was just a quick point to say that as well as the Oral Health Improvement Advisory Group that's established, we do also have in NHS England to support commissioning conversations and service pathway review, and encourage communication between different providers across the dental pathway. We've got a North Yorkshire and the Humber local dental network, and unfortunately that is a group where NHS England funds the chair. Simon Hernshaw is the chair of that group, and I think he's on annual leave this week, so wasn't able to attend. So that group is something that we are looking at reviewing. It is a North Yorkshire and the Humber group, so it does have a wider footprint, but that group should have representatives of all of the different contractor groups that we have. That encourages sort of pathway redesign, some of the quality conversations. It is an opportunity for providers to feed back to commissioners as well, and what we are going to be doing is working with colleagues currently in the CCG, but in the ICS, so that we develop that group whilst NHS England retains the responsibility for dentistry before it goes over to the ICS in April 23. Am I going to get my numbers right? So there is also that forum that is in place, as well as the oral health group as well.
Thank you. Before I go to Councillor Vassie, Siobhan, did you want to come in on this?
Thank you. Yes, it was just to say that one of my colleagues, one of the other dental public health consultants, has been doing a rapid oral health needs assessment. So that should highlight the inequalities, and he'll do it on an ICS footprint. I think there's some local authority information in there as well, but it'll highlight those most at risk in terms of oral health inequalities. And I know top of his list will be deprivation. So if I put up a map of deprivation in York, I could overlay a map from the epidemiology survey showing the decayed, extracted and filled teeth in children. So that'll be a great piece of work going forward in terms of where the focus should be.
Thank you. Councillor Vassie.
Thank you, Chair. It's just to develop the points that have just been talked about and the issue that raised by Councillor Heaton. When we first talked about this in September, was it? I don't know. When we were preparing for this, we did wonder whether there were statistics that would show us if there had been increases in extractions for children over the course of the pandemic, specifically, which relates, I think, Deborah, to what you were saying about primary and secondary care. Do those statistics exist now so that we can get a sense of what that blockage has caused in terms of repercussions for children in particular, but adults as well?
We don't hold that information as yet, Councillor Vassey, in public health. I don't know whether that will be covered in the needs assessment, Siobhan, that I think it's Martin that's doing.
It is. Well, unfortunately, the epidemiology survey didn't go ahead during that pandemic. So that would have shown the MBIT, the DMFT. The MBIT stands for missing, which is extracted teeth. And that would have been a great element to focus in on. You may be able to get some figures from the provider. So that will be York Trust. They would hold numbers of children having extractions, and you'd have to filter out City of York residents because it is a referral centre for wider than just York.
Yeah, I think that just came into my mind just as you were just about to say, Siobhan, that is data that will be held at York Hospital, but we would endeavour to be able to get that to inform this discussion. Fiona, I think, might have a comment on that as well.
Just to add, sorry, Anita, is I suppose the complication is that lists weren't running as frequently during the pandemic, so that's kind of a muddling factor there as well.
Thank you. With that, so that potentially is information that might help us, I think, Chair, isn't it? And thank you to all of you for your comments.
Thank you. Fiona, is there something you want to add there, or?
Yeah, it was just on that point about tooth extractions and admissions. So not from a York perspective, but nationally, admissions for children did go up sort of from last sort of May, June time nationally. And the main reason for that nationally was for a backlog of tooth extractions. So I think we probably could expect that we will see the same thing in York as well.
Just to add to that, I'm aware from a conversation, I think Philippa was there as well, that York at the moment have some COVID restrictions on the numbers of children accessing their list. So instead of a list for extraction seeing 8 children, it's only seeing 4. But I gather Harrogate does have further capacity. So some York children who are able to travel are being referred to Harrogate to try and decrease that backlog. So it's probably a wider issue in terms of the information you should have to collect in terms of children who've had general anaesthetics for extractions.
Thank you. Any further questions, members, or anything else anyone else wants to raise currently? Not seeing any other indications at the moment. So we've got some recommendations attached with the report on page 19. Aside from noting the contents of the reports, and thanks very much to Sian and the Health Watch team for the report, and Debbie for providing the report on behalf of the NHS. We've got some recommendations, and these include supporting the implementation of the oral health strategy where they can, support the further development of flexible commissioning opportunities across the city to reduce inequalities, and the provision of an oral health campaign with 2 strands, which are firstly to work across the system to provide information to local people on NHS dentistry options within the city, what's available in terms of emergency dental care if someone's experiencing acute pain, and the second strand on oral health and prevention of dental care, so around about self-care, how we can look after our teeth, teaching resources that may be used in early year settings, and across the life course. So there's some recommendations there that we can do, certainly at a local level, hopefully in the city, and the council public health team will liaise, no doubt, with colleagues in our health partners. I think we all know this is a national issue as well as a local issue. So I think really we ought to be looking as well, bearing in mind what we clearly see is the 2006 contracting, for whatever their intentions, have failed residents badly, probably nationally as well as locally. So it's a rare move, but given the seriousness of the issue and really lack of reassurance on improvement in the near future. I think we really ought to be using one of our few powers as a statutory committee to at least write to the Secretary of State to share perhaps some of the situation that we experience in York, and to give our support to some serious work on reforms and contracting, so that improves the lives of our residents, basically. So I think that's an important part. Obviously, we can't say what response we get, but we've got to, try and raise it to a national level as well, I think. Would members agree with adding that if we write as a committee? So, Councillor Taylor, Councillor Vassey.
Thanks, Chair. I mean, I do support that, but whatever this letter looks like, it needs to include reference to real terms sort of loss of funding, not keeping up with the needs of the growing population. And I don't know if the committee can do this, but it would be really, really good if at the bottom of this letter we can get providers on there as well, and other relevant health authorities, and maybe even the 2 MPs for York. Maybe not. I mean, a letter from this committee in itself would be good, but it'd be really strong to have a sort of whole York fist being made of this. And I'm sure the appropriate words could be found across those parties to make the points land in the right way.
Okay, well, we'll speak with officers afterwards and try and come up with something that might be appropriate. And yeah, I think that seems like potentially a way forward to raise this at a national level. Councillor Vassey.
Thank you, Chair. I agree with your proposal and with what Councillor Taylor has said. And I was just wondering if we might take this a step further. We've heard a lot of very compelling evidence this evening. We've got a number of very serious reports that show in some depth the situation we're in. And I was wondering whether we might ensure that that letter is accompanied by a summary of some of what we have heard today, and that we maybe yourself, Chair, and key officers sit down and look at that before the minutes are approved, or wait till the minutes are approved, and we can see clearly the figures, the problems, the challenges we face, so that we're not just sending a letter to a Secretary of State saying this is very bad, but we're quantifying the challenge. We're giving voice to the witnesses we've heard today, whether they're residents, whether they're the specialists in dental services or our own council officers, so that we've got something there that any Secretary of State has a clear view of the scale of the challenge. So if we could do that and incorporate that in the letter, I think that would be a good thing, and I'm happy to hear your thoughts, Chair.
What we could do, I mean, if each of our participants this evening wanted to perhaps send in a short summary to our officer, Louise Cook, we could include that in a pack along with the Health Watch report and the report from from NHS England, with a covering letter, obviously, from the committee. I think that's something that we could definitely do. And if participants are willing to do that, then please do forward to our officer, and we'll compile them all and send them off as a pack. Anita.
Yeah, I was just wondering if it would be helpful to have signatures from the members of the Oral Health Advisory Group, because it captures a lot of those partners.
Yes, that sounds good. Sian.
Yes, I just wanted to say that I've found today's discussion really, really helpful, really, really interesting, but it is quite surprising to have this many people together all feeling like we don't actually have the power to change a contract, which should be an agreement between two parties to deliver something. And I think I would wholly support the committee in writing to the Secretary of State to really lay that bare, that we need reform of this situation. We shouldn't be in a situation where we can't do the things we need to do to protect the oral health of our communities. It seems that there isn't anyone here who has argued that they're happy with how things currently are. There isn't anyone who thinks this is a good deal for our population. So in terms of the people who contact us and the reassurance we'd like to give them that something is happening, that something is changing, that when they phone us and say, I can't find an NHS dentist, and all we can say is, keep trying, but we know it's really difficult. I would love to be able to feel that we are moving this forward in a meaningful way at national level that means that something will change and this situation will improve. We first wrote a report on this in 2018. It's now nearly 4 years later and we've been through a heck of a time the past 2 years. I don't underestimate that, but there were massive problems in York before the pandemic, and so far I find it hard to believe that there are not going to continue to be massive problems beyond the pandemic if something radical and different doesn't happen. I think it was really powerful to hear from Jeremy that there aren't dentists out there thinking this is going really well. So there must be a coalition for change here. And I think that I would really, really love to see something come from us to national government saying, let's change this, let's do something better. I think we have some ideas in our report about things that could be done, about ways that the world could change to actually benefit us all. And I'd really, really like to see something happen.
Thanks very much, Sian. I think that's probably sums up what we all think. Right, I don't see anyone else indicating, so I think we'll probably come to the end of this particular item for now. But obviously, we'll pick this up with officers and anyone that wants to send in any of the participants from the bodies that have joined us this evening. If you want to enclose or forward something to the officer, we'll certainly look to include that in the submission. Thanks very much. You're welcome to stay for the rest of the meeting, but likewise, I appreciate you've probably been busy all day, so if you want to drop out now, please do. Just wondering whether members want to take a short break before we move on to the next item. Probably take an indication. What time is it now? 19:14. Should we say 19:25 to resume? So around about 10 minutes for a quick comfort break. Yeah, okay. Thanks very much. And thanks very much for those that are leaving us now. Thanks for your contributions.
Thank you.
Chair, it's Richard here. Just on mute.
Thank you, Richard. Apologies and welcome, ladies and gentlemen, to the second part of the Health and Adult Social Care Policy and Scrutiny Committee on Monday, the 24th of January 2022. We're now going to agenda item 5, which is childhood obesity in York, pages 31 to 42 in the agenda. And to introduce this item, we've got Lee Bell as the Public Health Specialist Practitioner, Advanced, and also Fiona Phillips stayed with us for this item, Assistant Director for Public Health. Good evening, Lee. Do you want to introduce briefly?
I think Fiona's speaking to the item, not me.
Okay, thank you.
Yep, and thank you, Chair. So yeah, the aim of the paper really is to firstly update you on the levels of obesity in York, but then also to update on some of the work that we've been doing to address or try to address this. So in the background section as well, there's a definition of what we mean by obesity for adults and for children. And the reason why I just want to sort of highlight that is just to really make it clear that what we're talking about is a health condition that will lead to further health complications. It's not about making a judgment about how people look or body image. We're talking about a health condition. So that definition also makes the point as well that those ways of determining obesity are really good population measures, but they don't always hold true at an individual level. So, you know, we probably all have examples of people who have a body mass index of over 30, but are fit and healthy because they're sports people or other reasons. So just wanted to clarify that. So in terms of the data, just for context, I've given data on levels of overweight and obesity for adults, which shows that we have lower rates than England as a whole, but that still means that around 60% of our adult population in York is above a healthy weight. And when we compare with areas that are similar to us, the lowest rates in those areas are around 55%. So we could really be doing better. But I wanted to focus more on children and the data that we have for children in York. So about 1 in 5 children in reception classes in York are classified as overweight. So that's over 200 4- and 5-year-olds in York who are above a healthy weight. And then by the time those children are getting into year 6, that percentage goes up to around 1 in 3. So nearer sort of 250 children who are above a healthy weight at the age of 10 or 11. So again, whilst we generally have lower rates than England, we don't compare as favourably when we look at those local authorities that have similar characteristics to us. And one of the worrying things as well is when you look at the trends in that data for obesity in children, it does appear to be going up. And then the other part of the picture that concerns us is that those 200 plus children that we see who are above a healthy weight, they're not evenly distributed across York. So they are more likely to live in our more deprived wards, they're more likely to be from Black and minority ethnic groups, and they're more likely to be boys. A couple of other things just to highlight that kind of link with this. So physical activity and being active is one way of addressing healthy weight. And in York, we generally have quite an active population. But what we've seen over the last couple of years is that the proportion of people meeting the physical activity recommendations has gone down. So that kind of worries us as well. Also want to just raise the issue, and I've put the data in there in terms of the number of women at the time of booking in for their pregnancy, the number of women who are obese at that point, and obviously that has implications for their pregnancy, but also the health of the child as well. And then just a bit of a nod to what we're likely to see in our data as a result of COVID. So the data on childhood obesity that you've got here doesn't include the kind of year before COVID. And what some of the national research is starting to show us is that there was an impact on children through COVID. They spent a lot of time out of school, weren't able to take part in a lot of the sort of clubs and activities that they might have done. Many children who rely on school meals for a healthy meal wouldn't have had access to that. So we're expecting that that upward trend is probably going to continue. So in terms of you know what we can do to tackle this, so if you look at obesity in a very simplistic way, if you put more calories in than you burn, you're going to put on weight. But that's very simplistic, and given all of what I've said about the inequalities that we see in obesity, it is more complex than that. And actually obesity is probably one of the most complex public health issues that we try to address. So the environment that people live in has a huge impact on their ability to be able to make healthy food choices. And what all the research shows is that those unhealthy food environments are more prevalent in the deprived areas. So whether that's the kind of advertising that is targeted into those areas, the number of takeaways, or access to shops for healthy food choices, are all very different in more deprived areas. One of the other factors is poverty. So only about half of the UK households actually have a budget that's sufficient to be able to follow the government's healthy eating guidelines. Also, I've talked about physical activity. So we see as well that in more deprived areas, there tend to be lower levels of physical activity. And again, that can be linked to income, access to spaces to be physically active, and also people's time that they have available to be able to be active. So nowhere really in the UK has addressed the issue of obesity. There was a story going back to 2019 when Leeds was widely reported to be the first local authority in the country that had seen a drop in childhood obesity. That was quite a small decline, and looking at their figures now, it appears that their rates have increased since that time as well. At that point, the stories at the time attributed the success in Leeds to a programme called HENRY, which stands for Health, Exercise and Nutrition in the Really Young. So I don't doubt it's a good programme, and I'm going to talk a little bit about what we're doing around the HENRY programme in York in a minute. But clearly, given the issues of the environment, poverty, having one programme isn't going to address all of the issues of obesity. So Public Health England, which is now the Office of Health Improvement and Disparities, a few years ago had started a piece of work that they'd called a whole systems approach to obesity. And what that was based on was sort of international research, particularly coming out of Amsterdam. So Amsterdam is widely recognised as probably the only place in the world that has had some success in tackling childhood obesity. So it's kind of being studied by a lot of areas and a lot of other countries, looking to see, you know, well, what have they done in Amsterdam? How have they been successful? And much of that research comes down to kind of three main factors in what they've done. One, they had really strong leadership across the city on the topic of obesity. They also made a pledge to do things differently. So an acknowledgement that if you keep doing the same thing, you're just going to get the same results. And then thirdly, they took a multifaceted approach. So in the paper, you can see they had 10 pillars of their action to tackle obesity across the whole city. And what you probably notice is that most of those actions fell under the kind of bracket of prevention and preventative approaches. So in terms of what we're doing in York, so we have a healthy weight steering group which was set up back in 2018 and developed a healthy weight strategy for the city. And that strategy really aimed to
May have just lost connection.
Take looking at sort of children, but also looked to address the environment in which people live as well.
We just lost a little bit there, Fiona. The lines froze a little, so you might just have to backtrack a little bit.
Oh, apologies. Where did you? Sorry, when did you lose me?
not long back. If you go back a minute or so.
Okay.
It was about introducing
okay,
the
apologies. Hopefully my
You had talked about the 10 pillars.
Okay, so I was talking about, so we have a healthy weight steering group in York that has developed a strategy to tackle obesity for York. And our approach in the strategy, we take a life course approach. So looking at what we can do around children, adults and older people, but also looking at the importance of mental health as a contributing factor, and also looking at the environment and what we can do to address some of those environmental aspects within York. One of the areas that we've probably made the most progress on over the last few years is around the pathway to support people who are above a healthy weight. When we started the strategy group back in 2018, there weren't really any services to support people in York who wanted to address their weight. You had to go to a commercial provider to buy that for yourself. So we now have a pathway that goes right from what we call tier 1, which is the giving advice to people, signposting people to where things that they can do themselves, right through to what we call tier 4, which is surgery. But it's quite a fragile pathway. So we had additional funding from government, but it's quite short term. So in terms of adults, that's enabled us to provide Slimming World free to people who can't afford to pay for it themselves, and also to subsidise our leisure provider, Greenwich Leisure Limited, to provide more weight management courses. And then for children, we have been working on implementing the Henry programme, which I mentioned before, which will be able to provide support to parents of children 5 and under to help them to look at their kind of planning around meals and diet and exercise for their children. But as I said, just looking at treatment options alone isn't really enough. So one of the things that we also did in 2020 as a council was to sign up to the Healthy Weight Declaration, which outlines how we'll address some of those broader environmental aspects. We've had good success in some of this work, particularly work we've done regionally with other councils around developing advertising policies to reduce advertising of foods that are high in fat, salt and sugar. But there's still quite a lot to do in this sphere, and obviously having signed that in 2020, we did that about 2 months or a month before we went into the COVID pandemic, so we haven't made as much progress as we would have liked to on that. And then the other piece of work that has been started recently is work on the back of the National Food Strategy, work to look at developing a food strategy for York, aiming to address some of those issues around food poverty. So I think in conclusion, it's a really complex issue. We have made progress in some areas, but there's quite a lot more to do. It's a public health problem that can't be solved by public health alone, probably can't even be solved by the council alone. but is going to take the whole system really to address and recognise that it is an important issue that everybody feels is worthwhile addressing. Thank you.
Thanks very much for introducing Fiona. I'd like to welcome back Jamila, and should also mention Councillor Taylor was on call this evening and had a referral he needed to deal with, so that's why he's no longer with us for the remainder of the meeting. Right, we'll go to members' questions then, please. Councillor Vassey.
Thank you, Chair, and thank you for the presentation, Fiona, and the report. It's very interesting. One of the challenges, it strikes me, is that with all this kind of stuff, you want to help steer people without being preachy. And it seems to me that one of the qualities of what we've got here presented in the Amsterdam approach is that they do engage with this. And I look at the initiatives in our city, and you mentioned quite rightly the huge correlation between poverty and all of this, not least because cheap food is quite often the unhealthy option. And it just left me just having a couple of thoughts that I'd just throw out for discussion. If you spend 40 pence on a mozzarella in a supermarket, you only get a high-fat mozzarella. If you spend 70 pence on a mozzarella, you can choose to have a low-fat mozzarella. And it makes me think, I mean, and this is replicated across the aisles, obviously, in different ways. It makes me wonder whether the local authority has more that it can do to work with our city's supermarkets to try and come up with joint campaigns. And in particular, supermarkets over the past 2 years have been noticeably engaging with the generosity of residents by providing an opportunity for people to donate food for food banks and for customers who have less money. I was wondering whether there was work the local authority might do to work with supermarkets to find ways of encouraging that generosity, to be cognizant of the nature of the food they donate. Again, I recognize this is all very vexed and complex, but I do wonder if people are being generous and thinking, well, I'll give 4 tins, not 2 tins, and then buying the cheaper tins, and whether all of those things conspire to allowing situations that we know don't provide healthy outcomes. And it would be good just to have your thoughts, Fiona, on what we're doing with supermarkets in that regard, and with schools, to ensure that while at schools, children, when they do cooking, for example, have a chance to see how those different ingredients work so that they don't feel intimidated by healthier options. So I'm just happy to hear your thoughts.
Yeah, so we haven't really engaged with some of those big supermarkets, and it's quite hard sometimes to engage with those national chains. But I think where we have engaged is with the food banks, and particularly the piece of work that I talked about around the food network will aim to bring food banks, but also some of the other sort of pay-as-you-feel cafe type venues that we have in York, just to kind of bring those together to look at, you know, what is the food offer that they have. Because you're right, we don't want to on the one hand be thinking that we're doing the right thing, but actually sort of contributing to the issue. I think schools is a really good point, because we've got a good option or an opportunity right now, given the kind of changes in the national curriculum, and PSHE is now kind of firmly part of the national curriculum, and that's where schools will often cover those topics around healthy eating, and you know, physical activity is part of that as well. So definitely working with schools to support them in that role that they've got in terms of that part of the curriculum. So that's a really positive change that's come in the school setting.
Thank you. I guess with the supermarkets, as you say, Fiona, most supermarkets are national chains, and it's difficult to communicate, I guess, with them on certainly on pricing, because they'll have the national pricing policies on whatever item it may be. So I think it would be difficult to negotiate a lower price for a lower fat option on a local basis. I don't think the supermarkets will have the ability to do that. And likewise, the donations you refer to, Christian, generally come from individuals that have purchased the items at the supermarket rather than the donations from the supermarkets themselves. Although you do hear from time to time schemes, some of the supermarkets, I think perhaps with some of the near dated things in particular, have had more involvement with making sure things don't go to waste and used appropriately. So there maybe are some things that can be done on a local level, but I think that's quite limited in that respect. That's my view on that anyway. Any further questions, members? I've got a few questions myself, and obviously if anyone wants to chip in at any point, just indicate and I'll shut up. Now, in terms of we're told in the report, and I'm referring specifically to page 34 on childhood obesity rising, I just wondered, has any analysis been undertaken of the previous strategies to understand what might have worked and what didn't, and what did work, and just as a learning tool, really?
Do you mean in York?
Yeah.
Yeah. Well, I came into post in York in 2016, and I'm not aware of what local strategy there was prior to then. And as I say, we didn't really have a pathway for supporting healthy weight in York. So, I think we were starting from quite a low baseline really on that. I think what I would say, just in terms of nationally, what's been seen is that we've spent too long focusing on individual treatments for people and seeing it as an individual's issue, and it's down to the individual to change their behaviour. And that's why, whilst it's a part of the pathway, and an important part, I think if we see that as the only thing, we're not going to make any shift, because I'm sure a lot of you will probably share, you lose weight, it's difficult to maintain, you put it back on. If the environment that you're surrounded by is weighted towards unhealthy options, lack of opportunities for physical activity, you can just go around that cycle of weight loss. So I think nationally, that's where we've tended to focus. And I think it's only really been fairly recently, in the last kind of 5 years, looking at what's come out of places like Amsterdam, that there has been this recognition that, actually, yeah, we're doing the same thing and just getting the same result. And actually now we have to start thinking about different ways of tackling this.
Following on from that, you referred earlier to the Healthy Weight Declaration in 2020, and I'm often interested to know how these kind of declarations that are often made by the council in one area or another impact residents in the kind of the day-to-day lives. And so can you tell us what the council's done differently as a result of signing up to this declaration?
Yeah.
What kind of roadmap it's delivered, and would any of that have happened anyway, would you say?
Yeah, so as I say, we signed up to this and then kind of went into COVID, and so this has not moved in the direction as quickly as we want to. I'd say that the one tangible thing that we have taken forward, and it's due in parts to some work that we've done on a regional footprint, is around the policies for marketing. So this is kind of taking a kind of health in all policies approach, if you like. So looking at what are our policies as a local authority around how we use our advertising space, and writing into that policy that our advertising space won't be used for products that are high in fat, salt and sugar. And regionally, we were supported with Public Health England to work with a charity called Sustain. If you're not aware, Sustain are the charity that worked with Transport for London, who successfully stopped advertising of products that are high in fat, salt and sugar all across the Transport for London network. So that was regionally funded by the Directors of Public Health in the Yorkshire and Humber region. And because we were kind of quite far ahead in York in terms of having signed the declaration and starting to take this work forward, Sustain supported us as an area to look at our policies and implement that. So that's a really tangible way of how things that the council has control over and has policies around, we can get wording into those policies to mean that we're not inadvertently doing things that actually don't take us further forward in terms of some of our other priorities. So there is a link to the roadmap in the paper, but as you can see, there's 14 areas, 14 commitments. So now that we have a bit more capacity within public health, this is one of our next priorities to pick back up that work and look at how we can make the difference, because like you say, we didn't really want this to be a declaration that we signed and then it just kind of sat and nothing was taken forward with it.
Thanks, Fiona. Councillor Hook.
Thank you, Chair. I'm just thinking, because I'm on the licensing committee as well, it probably nothing that licensing could do, but I just wondered if there was a possible avenue towards stopping fast food things proliferating too much so that you can go from one cheap place to another and just eat, that sort of thing. And the other thing I was going to say was, because I think everyone is feeling a bit more down because of COVID and because of being isolated and everything else, I think, especially in my case, comfort eating is one of the things I do. And I don't have the energy or the inclination to cook. So I'm reaching for the packet of crisps like I just have, or the chocolate bar. And naturally my weight's just done that. But how do you get to snap out of that? And at least I probably could make myself, but I think that's going to be a national epidemic with people doing that.
Yeah, so just on the first point around fast food outlets. So you know, you might be aware that in some local authority areas, they've objected to new, what they call A5 licenses for fast food takeaways on the basis of its contribution to obesity levels. Depending on who the application is from, you know, if it's a big chain, they have quite a strong legal team behind them to object to those objections, as it were. So you have to have a really good evidence base behind you to demonstrate that. One of the issues that we've got in York, because we have looked at this, so if you have an area that has high obesity levels and you can demonstrate that actually you've got a saturation of fast food outlets in that area connected to where you've got the high obesity rates, you can start to build that evidence base. Because of the city centre in York, most of our takeaways kind of congregate in the city centre, which is not where our obesity rates are the highest. So we find it quite difficult to kind of build that evidence base behind actually putting in an objection to a change in licence or a new licence. So it is a really is a really tricky one. I mean, I think when we kind of look at some of our areas where we do have higher obesity rates, you know, then they're not necessarily so proliferated with takeaways. But I think one of the challenges now is almost where takeaways has almost become irrelevant with things like Deliveroo and Just Eat. You know, you don't have to have a takeaway round the corner anymore. You can just pick up your phone and it's there, really. So it just becomes a really challenging environment, really.
I think some of the city centre proliferation is probably linked to alcohol, and that's another issue in itself. Councillor Vassie.
Thank you, Chair. Yes, two thoughts springing on from what you've just been saying. Yes, planning can act as a stick to try and stop things happening that we don't like happening. But has the council been involved in accreditation schemes for restaurants to allow them to show off if they're providing healthier alternatives, so that they can have on their window, you know, for example, healthy pizzas. I'm always told that pizzas are high-fat food. Actually, if you put a little less cheese on it and you use a low-fat cheese, it's not a high-fat food. Could we help encourage best practice by giving accreditation to those takeaways and restaurants that can have stuff taken from Deliveroo, that can boast they do the tastiest low-fat pizza in town? So just that positive carrot, healthy carrot, rather than a high-calorie stick to beat people with. So that was my first point. So just yeah.
Yeah, and actually, if you on our healthy weight declaration, our first commitment is around responsible retailing, and one of our future opportunities was to explore the idea of a healthy food award scheme for York. So yeah, it's definitely an aspiration, and you know, there are areas in the country who've done that really successfully, and I think the kind of city centre vibe, I think there would be a lot of retailers in York who would be interested in signing up to something like that.
Thank you. And if I may, just another point, Chair. Again, this relates to something that I think you were saying earlier, Fiona, about sports. I've just done a quick check while we're talking, having read about Amsterdam, and I'm a member of Energize in Acomb. I hadn't thought about it until we had this paper, but they actually have a scheme for people on low incomes to get concessionary prices to access the gym. Do you think there's more that we could be doing to communicate that to residents so that more people can feel encouraged? Because I think standard membership, I'm trying to remember, it's something like 35 quid a month. There are lots of people who would struggle with that. But if we worked with better Energize and promoted things better, that might encourage people to take advantage of what used to be a council-run facility, but is still now a community facility. Do you think we're doing enough to promote those kinds of concessions to encourage people to go?
I think there's probably always more we can do, and definitely income is going to be a barrier, and also, you know, the gym isn't for everybody. You know, one of the things that Lee is working on at the moment with partners, and I'm sure will probably come through this route at some point, is our physical activity strategy for the city as well, which you know, will focus on those kind of sport opportunities, but also on the kind of more physical activity. So what you can do in your local area, active travel, those initiatives, so that, you know, there's something everybody would want to take part in, but definitely income is going to be a barrier. So I'm sure that there is probably more we can do, and we can pick up that conversation with GLL, who are part of our Healthy Weight Steering Group, to see what we can do to support their kind of letting people know what's available in their centres.
Yeah, and quite often it's about having fun, isn't it? Because I can say from my own personal view, going to the gym is something I do. It's completely boring, but I do it and it gets me fit. But better energized, there are also dance classes and fitness classes and swimming and wall climbing. So there are things that are less kind of turgid and worthy and more fun. So it would be good if we were actively promoting that to help people feel confident about participating.
Yeah.
Thank you. Any more questions, members? Can't see anyone else indicating. I just want to ask something about quickly about Henry, and it is a scheme actually that Sharon spoke to. Some of the committee members may remember it's a good couple of years ago when Sharon spoke to us about it, and I actually raised it at full council not long after as an initiative that I thought would be useful for us to look at as a city. And I'm pleased the administration's adopted at least looking at some of it, if not all of it, as a method, or an additional method in along with parental responsibility, which is another issue, of course. But what I was interested to know, obviously, not the Henry won't be adopted in every school in the city because there won't all be ones that the council runs. So what would we be doing about the gap there in terms of, how would it be promoted across the city as a whole, or will it just be certain schools?
Yeah, so the kind of main routes into the Henry programme will be, so I talked about the National Child Measurement Programme, when people or children get weighed and measured in reception. So at the moment, what happens is if your child is weighed and measured in reception and they hit that kind of above a healthy weight, you'll get a letter to tell you that, but then there's no real offer of support other than to kind of signpost you to information that you can read and have a look at yourself. So that will be, so when we have the programme up and running, our Healthy Child Service will be able to have that conversation with a family, explain to them what the Henry programme is, and if that's something that they would feel able to engage with, then that's one route in. The other main route in will be at the kind of 2-year review that health visitors do. So when they're doing that 2-year review with a child and the family, if there are issues around diet, if the child is above their kind of centiles on weight at that point as well, then that's a conversation that the health visitor can have with the family about whether they want some support. So they're the kind of probably the two main routes in, and then the other main route would be through general practice, if a family are presenting to general practice. So I think because we're just starting this, we're running this as a new program, that's kind of we need to kind of pilot it and test out, see how it goes. So I think initially it will be through those kind of professional routes of referral. It may be in the future we open it up to self-referral, but I think we're going to start with those kind of professional referral routes.
Okay, thank you. Any final questions, members? No. Okay, thank you. So in terms of, well, it's more of a note than a recommendation, but it's suggested there'll be a report provided at a later date on the progress and the impact of the Henry programme. So Louise, if you could possibly just note that for the future work plan, and obviously liaise an appropriate point for bringing forward, if you wouldn't mind.
Yep, that's fine, can do that.
Okay, right. that takes us on to the work plan, I think. So later next month, some of us will be taking part in a joint commission slot with the Children Education and Community Policies and Scrutiny Committee around the Children and Young People's Mental Health Scrutiny Review. So there was a scoping report done by the other committee some time ago, and there's a refresh going to take place, and we've been asked to join that. So some of us will be taking part in that at the end of next month, and then the next informal forum is at the end of March. Is there anything else any members want to? Councillor Vassy. I think you've got your mute on.
Okay, I'm back. Sorry about that.
Okay.
As a result of the dentistry topic, I rang Health Watch this afternoon just to ask them some questions about their report. And you will, I'm sure you may already know this, I certainly didn't. Health Watch have decided they want to make mental health and young people's mental health one of their featured topics for the coming year. And they said that they are talking with Fulford School extensively to see if they can set something up there, and they would be very keen to work with us and to liaise with us going forwards. So I thought I'd just pass that on, because having seen the work they put into the dentistry report, I'm sure that they would be able to help us in getting that data that we've been struggling to pull together.
Yeah, I'm sure you're right. Louise, could you drop a line to Sian at Health Watch? She might well have seen that we're going to be doing this as a joint scrutiny, but perhaps it might make sense to, and not as chair of that particular committee, it might be beyond my realms, but I'm sure no councillor is going to object to Health Watch taking part or joining that, I'm sure.
Well, I know Jane's leading on it from our team, so I'll have a word with her and see she may have already been in contact with them, I don't know, but I will find out and we'll go from there.
Right, thanks very much.
No problem.
So
Okay.
I just say the person I spoke with today at Health Watch was called Roger Newton.
Newton, yeah, I know Roger.
You probably know him, yeah.
Yeah, that's fine. I can catch up with him.
Thanks,
Thank
Christine.
you.
Okay. Right. Is there anything else anyone wants to raise? Likewise, if there's any subject that you want to see come forward as an agenda item in the future, please do drop a line. Obviously we'll look at the potential of that as a topic. In the meantime, I'll see some of you later next month on the joint commission, and the rest of you at the next forum. I don't have anything else urgent to raise, so unless there's anything else anyone wants to raise just now, I think we're almost up. Yeah, okay, right, well, thanks very much. Louise and Fiona, would you just mind staying on the line just for a moment, please? And